Much has been written about the increasing incidence of mental health issues during COVID-19, and it's no great stretch to suppose stress levels have also risen. But how is stress manifesting? What symptoms are more prevalent now than pre-COVID-19, if any? Precisely because stress is a major precipitating and perpetuating factor for many chronic health conditions, this is a question we are trying to answer, and we need your help. Hello, my name is Richard Hawkey, and I'm the founder of Foster Health. After experiencing my own stress-related burnout in 2010, I developed some stress self-awareness and management software with several doctors. We have 9 years worth of data pre-COVID-19 and want to analyze that against data captured since the pandemic surged in March of this year. Life has changed, and by gathering and analyzing data since then, we hope to gain a better understanding of exactly how COVID-19 has and continues to impact people's stress. From that research, we hope to be able to develop pragmatic action plans for managing stress and building resilience. This is an ongoing project. To date, we have gathered some data, and I will share these results with you over the next few minutes. However, we need a larger and more diverse participant population to arrive at any generalizable observations. And that's why we would like you, your family, colleagues, and friends to take the survey. Login details appear at the bottom of each of the upcoming slides and also at the end of this talk. Your participation will be greatly appreciated. Thank you. Before we dive into a bit of detail, the headlines we have found so far are perhaps not all that surprising. Mean stress scores, as measured using the Vitals survey, are up 7%. Out of the 22 symptom statements contained within Vitals, 18 have increased in severity and 4 have decreased. We'll dig a little deeper into these numbers shortly. And so to the software. Vitals is not a clinically validated instrument, but it is based on well-known biomedical and psychological stress symptoms, hence construct validity is sound. The software has also been used in academic research projects in 3 universities in 3 different countries, and results have consistently returned high stability and reliability, showing a Cronbach's alpha of 0.83. The design of Vitals was influenced by the biopsychosocial approach to health, understanding that illness and stress specifically manifests across different dimensions. The survey contains 22 symptom statements, as said previously, rated via a 4-point Likert scale. It is online, takes 5 minutes to complete, and is free and confidential. If we start to dig into the numbers, that 7% increase in mean stress scores is represented by a pre-COVID-19 mean of 41.6 and a post-COVID-19 mean of 44.44. But what does that actually tell us? The Vitals scoring scale goes from 0 to a possible maximum of 127. Categories range from functioning well to severely stressed, green through yellow, orange, and red. The scores mentioned appear in the moderately stressed category, with a post-COVID-19 score of 44.44 pushing towards highly stressed. Breaking this down a little further, we see that means for the 2 gender categories available in the tool differ noticeably, with males registering a significant increase in stress scores. Scatter plots reveal a fairly dispersed range of scores, and standard deviation around the mean remains relatively high in the 20s, both pre and post-COVID-19. This relatively high deviation means there are enough outlying scores, certainly in the dark orange and red categories, to warrant concern. If we now view that scatter plot data as a bar chart, we see a slightly different distribution pre and post COVID-19. The 2 lowest stress score categories, where people are functioning well or only slightly stressed, account for 37% of the population pre-COVID-19, but that drops to 29% since March of this year. Looking at it from the other end of the scale, the two most severe categories account for 33% of the population pre-COVID-19, but 40% post-pandemic lockdown. The data for the pre-COVID-19 population was taken from the 350 users of the Vital software leading up to February 2020. We have many thousands of datasets dating back 9 years, but thought it more relevant to limit our pre-COVID group to more recent users. Our post-COVID-19 group is taken from April of this year onwards, and this group currently only comprises 62 complete datasets, hence why we are requesting participation from you, your family and friends. Now to the symptom data. The statements in Vitals have been abbreviated to their underlying symptom in this chart for ease of reference and understanding. This chart shows the total of the two most negative responses per symptom statement expressed as a percentage of total respondents. For example, if you look to the symptom at the top of the chart, chest pains, pre-COVID-19, 7.3% of the 350 respondents answered frequently or always to the statement, I experience unexplained chest pains. That figure rises to 8.06% of the 62 respondents post-COVID-19. These are the 4 symptoms that have decreased in severity based on the self-report responses from our 62 post-COVID-19 data sets. As mentioned earlier, the data post-COVID-19 is insufficient to make any statistically valid observations, and these results do not contain any qualitative data that could provide more insights into why people have responded the way they have. At this stage, we can only speculate. If we look at the first one highlighted there, loss of meaning and motivation, it's the underlying symptom behind the statement, I sometimes wonder what's the point. Negative internal dialogue is associated with stress, burnout and depression, and the symptom often correlates positively with the last symptom on this list, hates job, disillusioned, which stems from the statement, I hate my job, why did I choose this career? The fact that both of these symptoms have decreased in severity since COVID-19 is interesting. I would posit that negative events that involve loss and fear often give us perspective on our own situation. With COVID-19 so viscerally impactful for all of us, it may well be that it has also forced some introspection and realization that we need to be grateful for what we do have, as so many people globally are suffering unimaginably. Unfortunately, only 4 symptoms decreased in severity. The remaining 18 increased. I'm not going to go through each one. We just simply don't have the time to do that, but please do contact me via email if you'd like more information and discussion, and my email address will appear at the end of this talk. But I did want to highlight a few obvious symptoms of concern. The slumbering giant in the room is poor quality sleep. That's the underlying symptom behind the statement, I wake up feeling refreshed after a night's sleep. And 63% of respondents post-COVID-19 answered that statement with either never or only sometimes. So we know that poor quality sleep is a global health issue. Even the pre-COVID-19 figures support that, and they have done with the 9 years worth of data that we've got. But the fact it appears to be getting worse is especially worrying during these uncertain times. Reduced immune system function and negative impact on mental health are just 2 of the outcomes when we have chronically poor sleep. The good news is that there are a host of apps, programs, websites, educational materials to help people improve their sleep, and it's possible that then this might be a worthwhile area for a public health literacy campaign. 2 other results that can possibly be explained are sense of isolation and social withdrawal. These are likely causally linked with the social and physical impacts of quarantine and lockdowns. However, just because we can kind of understand why they're happening doesn't mean we should ignore them. because the impact of those fundamentally negatively impacts the beneficial aspects of human relationships, interaction, comfort, safety, love, which are critical to our well-being. Yes, we can survive in isolation, but it is unlikely we will thrive. And balancing the epidemiological needs to socially distance and even isolate with the need to interact and connect with others physically will remain a challenge for some time to come. Lastly, on this slide, I'd like to draw your attention to the symptom fourth from the bottom: food, alcohol, and drugs dependence. This stems from the statement, I find myself using food, drugs, or alcohol to make myself, to make myself feel better, or to simply not feel at all. Again, we know this is a societal problem, fueling many so-called lifestyle illnesses. What this preliminary data suggests is that impacts from this increase of using food, drugs, and alcohol will likely manifest in associated increases in the incidence or severity of associated conditions such as diabetes, chronic obstructive pulmonary disease, and various cancers and so on. If there's anything you'd like to discuss with me or get some more information about, please do contact me via email. It's displayed on screen at the moment. And as I've mentioned a number of times, we need more participants for this survey. We need a wider, more representable population. So please use the Vitals software. Access it using the credentials you can see on screen right now. A simple website, and you have to use COVID-19 as the employer code. Follow the simple on-screen instructions, and a unique access link will be sent to you. Again, if you haven't received that in 5 minutes, just check your spam or junk folders, and it'll take you 5 minutes to complete the survey. If you could share those details with your networks or with people you feel comfortable doing that with, that would be a great help to us. And in the future, in the coming months, we will update these results and make them available again. Thank you for your time and attention. Stay safe.